Each decade, the U.S. Department of Health and Human Services releases data about sex education among teens in the United States. We'll be expecting a new release in 2020, but for today, we'll look at the last release, which was in 2010. Using data gathered from the 2006 to 2008 National Survey of Family Growth, writers of these documents found that most teenagers, 96% female and 97% male, received some form of formal sex education before they were 18 years old. However, the content of that education varies dramatically. The NCHS data brief suggests that 92% of male and 93% of female teenagers report that they were taught about STDs, and 89% of male and 88% of female teenagers reported receiving instructions specifically on how to prevent HIV or AIDS. A larger percentage of teenagers reported receiving formal sex education on how to say no to sex than receiving formal sex education on various methods of birth control. And the research shows that male teenagers were less likely than female teenagers to have received instructions on these various methods of birth control. Even today, a large number of U.S. teenagers receiving formal sex education instruction are in an abstinence only until marriage program, despite the fact that a federal evaluation finds these programs to be ineffective. Mathematica's evaluation found no evidence that abstinence only until marriage programs increased rates of sexual abstinence. In fact, students in abstinence only until marriage programs had a similar age of first sexual experience and a similar number of sexual partners as their peers who were not in these programs. The average age of sexual interaction was still 14 years, 9 months, regardless of the program. And the research found that abstinence pleasures had the same rate of sexually transmitted diseases as their peers who had not pledged abstinence. In fact, in communities where there are higher proportions of pledgers, the overall rates of sexually transmitted infections and diseases were significantly higher than in other settings. As many of you saw in this week's discussion and through discussing your own experiences, there's a great deal of room for improvement in sex education programs in the United States. One of the issues at hand is the content of what should be covered in a comprehensive sex education program. In 2008, scholar Louisa Allen looked at what students wanted to learn more about in sex education programs and what they felt was not necessary to be covered in more detail. Allen found that students really wanted to know how to make sexual activity more enjoyable for both partners. They also wanted to know about abortion and teenage parenthood, as well as emotions in relationships and dealing with the breaking up of a sexual partnership. Students stressed that they didn't want more information about clinical aspects of sexuality, such as reproduction, menstruation, and puberty. They also didn't feel that they needed more information on sexually transmitted infection and diseases or condoms and contraception. And they specifically said that they didn't feel that they needed more information of the effects of drugs and alcohol on high-risk sexual behaviors. Given the limitation of traditional sex education programs and abstinence only until marriage programs on sexual health, there's been an increased push in striving to achieve a more comprehensive sex education program in the United States. This was covered in detail in the reading that you had for this week. Comprehensive sex education programs within a school system would cover a number of different topics, including teaching about the differences between sex, gender, and transgender concepts. There would also be an increase in talking about sex education for different populations of people, such as individuals with physical or intellectual disabilities, and thinking about how sex education might be addressed in diverse community settings. At the beginning of this week's discussion, I asked you what might be part of your ideal sex education program. I'd like you to continue this line of thinking and using what you've learned in this module, consider how might an ideal sex education program improve our understanding of the social dimension of human sexuality? How might it specifically inform sexual health, not just physically, but also mentally and emotionally? And what social forces or institutions need to be more active if we want to see a transition to more comprehensive sex education and sexual health agendas?